Hey everybody, welcome back to Is This Podcast. I'm your host, Kieran Watts. Lovely to see you again. Or welcome for the first time. If this is your first time watching an episode, please do consider liking and subscribing. Leave a comment, whether it's nice or not. I've got a thick skin, I can take criticism. It only hurts my soul. Speaking of things that hurt my soul, Afghanistan. You may have seen the episode that I did. It was just me. So just talking about it. A bit of a clusterfuck inside of a cinder box, really. But, continuing to think about it, continuing to send our best to the people of Afghanistan, especially women and girls, and minority communities who are facing persecution, and also the earthquake in Haiti. I mean, that's, well, as experts would describe it, terrible. So thoughts to the people of Haiti as well. For what it's worth, there's not really a great deal that I can do. I'm in Wales on Zoom, just talking to my camera. But thoughts are with you. There's plenty of organizations out there that are working to help. And if you can afford to, do consider, donating and giving them some relief, and helping with the efforts to salvage a society that was already in crisis, that's now just been hit again. On to lighter news, the COVID-19 pandemic, which is going badly. I feel like after 18 months of this shit, I'm just struggling now to sort of just find ways to even feel emotional about it, which is bad in itself, because it's kind of like having to remind yourself this isn't normal. That this wasn't our lives, but it feels like it has been now for pretty much forever. But living in the new normal, as people call it, it's different for some people compared to others. And perhaps no region on earth knows that better than Africa. So joining me to talk about that now, from Kenya, is a friend of mine, communication specialist. Please welcome to the show, Sharon Quntai. Sharon, thank you so much for joining me.
Thanks, Kieran. Thanks for having me on your podcast as well. So as you said, I'm a communication specialist based in Kenya, and I specifically have an interest in global health. And I've actually worked on global health projects for over 5 years now. With NGOs, faith-based organizations, both local and international, also pharmaceuticals. So this is something that I really do have an interest in, and considering how we're seeing many cases of COVID-19 cases in Africa, this is definitely a conversation that should be had more, so that people actually understand what's going on in Africa and how we can really, get help, and things like that. Yeah.
And there's obviously there's so much to unpack.
Yeah.
In Africa about the COVID-19 situation in Africa. The rise of variants, vaccine access.
Yes.
There's so much to talk about. Before we get into the sort of the broader questions, just want to check, are you okay in how have you and your family been over the course of the pandemic?
Yeah. Um, Definitely things have been different. Yes, my family is okay. I had several family members who got COVID and recovered. I have lost some family members as well. So it has been really hard, the uncertainty, the fact that, you can just step out simply to go get groceries and end up coming back home with an infection or a virus like this. It's not something that that is good at all. Even me as a mother, considering my son goes to school daily, he's in contact with a lot of kids and the teachers. So it's definitely different, but so far I can say that we're okay, we're coping. Yeah.
And I'm sorry to hear about the family members that you've lost. I mean, sorry for your loss. I mean, I think was pretty much the dominant phrase of 2020, and
For sure.
certainly defines the pandemic in many ways, not only in the sense of losing people, but because so many people lost so much,
Yeah.
whether it was their job or um, just basic things like being able to go for a meal with friends, being able to see a loved one
Yeah.
indoors. It's so many people did lose so much, and Africa has lost a lot. Um, I want to sort of start off by asking about what your perspective is on how the pandemic is playing out right now in Africa. And as you said, you're in Kenya. How is it playing out in Kenya as well?
Um, uh, Generally in Africa, the cases have increased very much, and there's still many restrictions in most countries. And people are actually considering getting the vaccines, getting the COVID vaccines. If you compare it to last year, it's completely different. People are now more okay with the idea of actually being vaccinated. So Kenya in specific so far has about 231,000 cases and about 4,000 deaths. So the government has been reviewing restrictions on a monthly basis, due to the rate of infections, especially in July, where it was very cold, and there's many people who have non-communicable diseases. So the government has been reviewing the restrictions and measures just to reduce the number of infections and the number of deaths as well. Recently, actually, just a real example, the government issued a mandate to the civil servants to all be vaccinated, or else they were going to take measures against those who didn't honor the mandate. So it's been pretty difficult because most people were definitely not ready to take the vaccine. But since the government issued this mandate, it was basically a matter of either you get vaccinated or you lose your job. So it was quite difficult for most civil servants. And recently, I just saw in the news that the government has now said that it's not really a must. So it's quite a confusing time, to be honest, because one moment it's mandatory, and then the next moment, then the government says that it's basically not mandatory after so many people have gone to get the vaccines. Yeah.
To sort of deviate a bit, to what extent do you think misinformation influenced people who were or still are vaccine hesitant, or maybe resistant to measures such as mask wearing, physical distancing? To what extent is misinformation at play there?
First of all, I would attribute most of the misinformation to lack of awareness. So there's been lack of awareness on benefits of the vaccines. Even if there's been a bit of awareness on wearing masks and the measures to take, people have not been really taking them that seriously, considering most people can't even afford the masks in the first place. Most people can't even afford the sanitizers, some very basic things. So the misinformation has definitely affected the population very much, especially like here in Kenya, where I can use examples. People do walk around, especially since there's a lot of social distancing. So most people walk around without masks, just thinking it's okay. And also the fact that people maybe some of them have never been infected or seen a family member who's infected. Most of them don't really think that it's a very big deal. So some don't even have access to, TVs or sources where they can get this information from. So it's been quite a challenge, to be honest. Yeah.
It's an interesting point there, because this is obviously a pandemic of poverty in terms of as with any crisis, it's going to be the most impoverished, the most vulnerable communities who sort of weather the most damage. But I've never thought of, but that's something that I thought of in terms of, say, education. As you mentioned, you have a son of school age. So like, with the disruption to education, that's going to hit poorer communities the hardest.
Yeah.
In many countries, it's the poor who can't access healthcare. It's the poor who are going to face food insecurity. I never thought of it from the angle of some people aren't wearing a mask because they just can't afford a mask.
For sure.
So some people don't know because they can't afford a television or a radio. I never thought of it that way, and that's when you think of it like that's incredibly stark.
Yeah.
And I think an indictment of the system. I mean, what one thing that often comes up is that COVID didn't really teach us anything new. It just stripped us bare, stripped the problems bare.
Yeah.
That's a fact. That's a very, in the grimmest possible way, as a fascinating angle look at it from. To come to vaccines, because there's so much furor, and I'm never sure if I'm pronouncing that word right, but there's so much controversy about the lack of vaccines in Africa. About I think 2% of the population. I may be wrong, don't quote me on it, but there's such a huge outcry over the lack of access to vaccines in low middle income countries compared to their wealthier counterparts. So my question is twofold. How has that hampered the response and efforts to contain COVID-19? How long will it take to undo the damage? And how do we get greater access in Africa?
There has honestly been a very insufficient supply of vaccines, of COVID vaccines for most African countries. And many countries have been using different vaccines. Like, for example, there's a time here in Kenya where people got the first dose of AstraZeneca. And at some point, the government officials were like, we don't have any more AstraZeneca vaccines, but we are thinking that we might get Pfizer. So the people who got AstraZeneca, the second dose, you might have to get Pfizer. So there have been such cases, and this has created challenges for most people, to be honest, because even the fear of using two different vaccines for the first and the second dose, obviously, it created a lot of fear and confusion to most people. There's also been a problem of identifying the priority groups, because government lacks sufficient information in their databases about, priority minority groups, and also people are very reluctant to take the vaccines due to myths and propaganda, which are being spread in Africa. So this has definitely slowed down the progress and increased the numbers of infections currently, by the way. I can't really say that I can predict the amount of time it will take to undo the damage, but I think it definitely might take a few years for Africa. I'm not sure if you saw this, but last week WHO was warning that 47 out of the 54 African countries were going to miss their September target of vaccinating 10% of their populations. So unless the continent actually receives about millions of doses. So this is something that is definitely creating more panic to also government officials and to the general masses, in Africa. When it comes to how we can facilitate access to vaccines, I think, as I said earlier, there's a very huge gap in awareness creation regarding vaccines. So especially on vaccine safety, that is something that people are definitely not sure about. And spokespeople who are speaking about COVID vaccines are not addressing the issue of vaccine hesitancy. Africans also need, I think Africa needs funders and they need donors to be able to get access to more COVID vaccines. And mostly also governments, African governments need to make sure that more health professionals are trained, because our health professionals, we have very few people who are trained on how to vaccinate people, especially when it comes to using different vaccines. Like now in Kenya, we've had AstraZeneca for quite a long time. So when maybe Pfizer is introduced, most health professionals probably don't know how to administer this new vaccine, and as well as monitoring and managing the effects of the vaccines. So I think healthcare professionals also need to be trained very, very much on how to do all these things. Yeah.
Do you think that it's perhaps a bit selfish of higher income countries when so few Africa, well, as you said, what was it, 47 out of
out of 54 countries,
are not on track to meet the 10% target by September? Is it selfish of high income countries to now say, right, now we're going to crack on with booster shots, as opposed to working towards vaccinating the global population? Because I mean, it's the variant argument, isn't it? So-called South Africa variant. I can't remember the name it was given off the top of my head. But obviously, if we just say, right, we're going to go for booster shots now, and then leave great portions of the global population unvaccinated, surely that's going to increase the likelihood of new variants arising, and
definitely,
which may even be able to evade, or at least have their efficacy reduced. Face of new variants. What do you think of that assessment?
I think it's definitely not a good thing, to be honest, because I can say that for sure Africa is in need of vaccines. As much as people are still reluctant, most people, as I said earlier, are now willing to get vaccinated to protect themselves. So definitely, I think that is a bit selfish.
To steer away from COVID, obviously, Africa has a number of health problems. We recently had Cote d'Ivoire with Ebola for the first time in, I can't remember exactly how long, but I think for the first time in more than 20 years. You had, obviously that's on the back of outbreaks in the DRC. and elsewhere, you've got several neglected tropical diseases, malaria, NCDs. What are the concerns that we have there about the disruption of health systems by the pandemic? I suppose when I asked you earlier about how long is it going to take to undo the damage, I suppose that should have been part of my questioning. But how long is it going to take for us to undo the damage to efforts to control those diseases?
Yeah. First of all, the main challenge, Kieran, is that most people are not willing to go to hospitals over, malaria because of misdiagnosis. As I said, most healthcare providers are not, and healthcare professionals are not fully trained or well trained on, diagnosing COVID. So, as you know, malaria has some symptoms similar to COVID. So most people are not very willing to go to hospital to be, checked for malaria or other diseases. And especially people with NCDs are suffering very much because, first of all, the healthcare workers are very burnt out. There's a serious dominance of COVID-19 here. So
see, people with NCDs, non-communicable diseases, for those who don't know the term.
Exactly.
People with NCDs are more likely to require long-term care as well. So they have to go to hospitals or other health facilities more often.
Yeah. So you see, most hospitals don't even have the capacity to have have inpatient NCD patients because first of all, there's some serious COVID-19 dominance. There's no space in the hospitals. Health workers are burnt out. Most health workers are really, really trying to manage the COVID-19 dominance here. So it's a serious, that's one of the concerns that NCDs, sickle cell disease, NTDs, even Ebola as it's come up, these are diseases that are now being neglected very much because healthcare workers are trying to, first of all, in the first place, most of them weren't trained. This is something that just sprang up on governments, on the healthcare workers. So most of them were not prepared for such a thing. So now trying to figure out how to actually manage, and considering how we really don't have that much hospitals in Africa, most of them weren't prepared for such a thing. So it's quite hard to not neglect the other diseases, considering the resources were not even there in the first place. Yeah.
And I think that that's a problem that virtually every country has had.
Yeah.
And most, especially in low and middle income countries. And it is tragic. It really is. And I wonder, I mean, and one thing as well, I would say is sort of like a reluctance, because if I was, say, diabetic, or if I had HIV, if I had any condition that compromised my immune system or put me at higher risk, I would be very reluctant to go to a hospital right now.
Of course.
And I'm fully vaccinated. I'm not trying to rub that into anybody watching who isn't. I'm very grateful that I am fully vaccinated, but I'd be really, really scared to go into a hospital it would terrify me, because I'm sort of like, if I get COVID, well, then that's the end of me.
Yeah.
That's how I would feel. And I'm not trying to sort of alarm anybody. If you do have a serious medical condition, if you do need hospital treatment, go. And they know what they're doing.
Yeah.
But I would be lying if I said I wouldn't at least be apprehensive. Do you think that we're going to learn from this? Do you think that we're going to learn from COVID about why we need to properly resource, properly fund,
Mm.
properly source our health systems. Do you think we're going to learn from this?
Governments definitely need to have better preparedness for vaccines, and luckily most African governments are working on that currently, also working with organizations internationally to, be better prepared for pandemics, because as we know now, even the variants are increasing, so we never know about tomorrow if there are going to be other pandemics. So I think that definitely this has been a serious learning lesson to most governments. Yeah, especially here in Africa. Yeah.
I mean, it isn't COVID I'm worried about right now, which sounds odd to say. It's the next pandemic that I'm worried about. And I am I want to believe that we will learn from this. I really do. The optimist in me is, say, 10 stone in weight. And the pessimist in me is about 25 stone in weight and currently sitting on the optimist's chest. Because I think we've seen this so many times, but we were like, yeah, we really need to prepare for this, for a possible major health crisis. We'll do it later. Let's focus on something else. Let's focus on something that gets us votes. Because, you and I both work in public health. And we both know, public health as a political issue isn't sexy. It doesn't grab people's attention the way that sort of the more populist talking points do.
Yeah.
That's what I worry about. I worry that, because I believe that Joe Biden, were it not for COVID-19, I don't think Joe Biden would have won the White House. I really don't. I think because COVID-19 was so visceral and so painful, and in comparison to the other guy, whose name I won't mention, he seemed to be taking it seriously. I do genuinely think that that's what won him the White House. Whereas I think when the pandemic recedes, I don't think there's a politician on earth who can run and win on the basis of public health issues. I really don't. Because public health is something that we rely on, but it's something that people find so easy to forget. I want to let you go in just a few moments, if you don't mind. I just want to ask you about something that I know you're passionate about, which is mental health, something I'm passionate about, as somebody who's experienced mental health issues myself. Obviously, when we're talking about the pandemic and we're talking about all of this, with long COVID, for example, we're talking about the physical effects. We're not talking, I don't think we're talking enough about the mental health effects.
Yeah.
So I'm wondering, what have you seen in terms of the effect of the pandemic on mental health in Africa? And, is there sufficient support there?
The pandemic has definitely had, it has led to some serious mental health problems here. And we weren't really talking about mental health as much before the pandemic. So currently, most media houses in Africa are currently focusing a lot on mental health issues due to the, people are getting these problems due to disease experience, having a very bad experience with the disease, social distancing. People who are used to seeing each other day in, day out, visiting each other and doing anything that they'd like, but that now all of a sudden you can't even visit a relative. There's a lot of stigma also and discrimination of the people who've been infected by COVID, or even if they were infected and they got well, you find that some people still stigmatize and discriminate people who've been infected. There has been a number of serious job losses. Like here in Kenya, I know so many of my colleagues, so many of my friends who have lost their jobs. So this has caused a very stressful situation for most people. So most places that are hardest hit by the pandemic have definitely they've had some serious effects, and especially mental health issues. Healthcare workers, especially, I have seen a lot of a serious rise of mental health problems with healthcare workers because
you mentioned burnout quite a few times as well.
Yes, exactly. So most of them are stressed out. It's a very stressful situation. Also, they're getting sick as well. Their relatives are getting sick. So this has caused some mental health issues to some healthcare workers.
And then there's the cherry on top of the shit cake. The fact that you're daily surrounded by human misery.
Exactly. And at some point, in fact, like here in Kenya, for example, some of the healthcare workers were not being paid, and it's during the pandemic. So it's been very stressful for most of them. Patients with COVID are really struggled with mental health issues because of the discrimination and the stigma that I mentioned earlier. Even patients with other illnesses, like we said earlier, who are not getting the help that they need. They're scared to go to hospitals. And one reason that other patients are also scared to go to hospitals, or people with other diseases are scared, is because they feel like here there's a myth that, and it's quite credible. It makes sense that someone would think that in the hospital, that's where you'll actually get infected. So people have been stressed out because they don't know what to do. And also their family members of people who've gotten COVID, family members of people with other illnesses. Now they have to take care of them more than usual because they don't want to go to hospitals. So and other people in general have been experiencing some post-traumatic stress disorders, anxiety, depression, insomnia, especially with the healthcare workers. So currently we've seen that there've been some social media and virtual mental health services, like here in Kenya, which have really helped most people, because most of them don't charge, especially the social media ones. They literally just offer, mental health advice on the platform. So that has been very, very helpful. Mental health services need to be really the response or response to mental health issues should be included in a pandemic response in governments nationally, because these services weren't existing before, or maybe but if they were there, they didn't really pay much attention. So there should be a focus on mental health services to people, especially during and after a pandemic, so that people are actually feeling better even after a pandemic. I can say that the support has been there, like I've mentioned, virtually on social media, like the virtual mental health education meetings and stuff like that, social media posts about mental health. They have really been helping very much. But as I said, the government doesn't really have a pandemic response, formal mental health response plan. So that really has affected a lot of people because there was no plan in the first place. So there is definitely an unmet need for those services nationally. So I think that with better preparation, maybe training of, we use a lot of community healthcare workers, community health volunteers here. They should basically be trained on first aid of people who get psychological or mental health issues. Basically, if they get some first aid, because they're based in the rural areas, it would really help matters here. Yeah.
Well, Sharon, it's been lovely talking to you, and thank you for your insights. It's Been a fascinating discussion, not always particularly light-hearted, for obvious reasons. Sharon, thank you so much for being here. It's lovely to see you.
Thanks, Kieran, for the opportunity also. Yeah.
Stay safe.
Okay.
That was Sharon Quntai from Kenya, everybody. Join us on the next episode of Why Is This a Podcast? I'm Kieran Watts. Stay safe.